Hello everyone and welcome to Module 8. This week we have probably the most chapters that we're going to really focus on, but they're all focusing on pharmacology and medication administration. So with that, we are focusing on 3 chapters. We're focusing on chapter 53, 54, and 55. So there's a lot to cover, and we're going to go ahead and get started. I'm going to go a little bit out of order here. I'm going to start with chapter 54. And chapter 54 is really focusing on pharmacology. And that is the study of medications and drugs, including their forms, intentions for use, and effect. Now, in Module 7, we started talking a lot about the classes of drugs in your lab classes, the schedule of drugs, as well as what types of drugs there are. Now, what we didn't discuss, and I know your lab teachers probably didn't talk on, was the generic names, brand names, and chemical names. A generic name is its official name of the drug, and it's typically written in lowercase letters. But it's also the legal name for the drug. A brand name is typically written with a capitalized initial letter, and this is the name given to the medication by the manufacturers. And lastly, we have their chemical name, which is a chemical formula used by the manufacturers and pharmacists. So in the example here, we have Tylenol. Tylenol is the brand name of a medication. Its generic name is acetaminophen, and its chemical name is N-acetamide. Now, I know that you probably talked about in week 7 with your lab classes also how medication is administered, and this is essentially how the medication is given in the body and how it can be taken. And there are a few ways that medication can be given. It will either be oral, parenteral, sublingual, inhalation, topical, drops, or suppositories. So I'm going to let you guys, I'm sure in your lab classes you guys have already talked about that, so I'm not going to go too much more in depth with that, but you can also read about that in your book this week. So for this chapter, most of it will be review, as it's stuff you may have already discussed in your lab classes. But one thing that I know wasn't probably talked on was reading and writing of prescriptions. So reading prescriptions or writing prescriptions is really for the physician, but as a medical assistant, you can set these up for them to sign off on. You need to be able to understand the symbols, the prescription pad, and the abbreviations that are used. It's also important that you understand the parts of a prescription, such as the superscription, inscription, subscription, signia or sig, physician's name, address, phone number, and DEA number, the number of refills, and the dispense's written line. A superscription contains the patient information, such as their name, address, date of birth, and the date the script was written. An inscription gives the name of medication and its dosage. The subscription is the amount of medication the pharmacy is to dispense to the patient. The signia is the instructions for how to use the medication. The physician's name, address, phone number, and DEA number need to appear on all scripts, except for the DEA number, which is the Drug Enforcement Agency number. It's assigned to all physicians that states that they're able to prescribe, dispense, and administer controlled substances. So if it's a controlled substance, that number needs to be present. And lastly, we have the dispense as written line. And this states whether or not a generic medication can be given if the brand or if it's brand name only. So that's kind of a quick wrap up for this week for chapter 54. Let's move on to 53, which is dealing with math and pharmacology. Now, I know that some of you, this may not be something that you're really looking forward to, but don't panic. It's something that you can work through, and it's something very easy that can be done. So when we're using math for pharmacology, what we're doing is calculating drug dosages. You will be using addition, subtraction, multiplication, division, fractions, and decimals. There are two systems that are used to calculate medication dosages, the apothecary method and the metric method. Now, most physicians will use the metric method, but sometimes it's going to also maybe be using the apothecary, so it's important that you really know both. Now, I'm really only going to focus on the metric system, but you will be responsible for reviewing the apothecary system that is in your book. The metric system is most commonly used for drug calculations and conversions. It uses the prefixes kilo, hecto, deca, deci, centi, milli, and micro. Metric conversions are accomplished by multiplying or dividing by 1,000, and the most common metric units for measurement are a liter for volume, gram for weight, and meter for length. In the metric system, dosages are written with a decimal number first, then the unit of measurement. So for example, you might have something like 25 milligrams. Alright, so let's dive into our discussion on drug calculations. Many factors are involved when physicians calculate correct dose of medication. Those are the age of the patient, the weight of the patient, their current health, and other medications they may be taking. The first step in drug calculation is to confirm that the systems of weights and measures are the same as the supply on hand. If they are different, you will need to do a conversion. For example, if my order said something like 5 or 25 grams, but on hand you had something like 50 milligrams, you would need to convert your order to match your supply on hand. There are two methods that we use for dose calculations, the ratio method and the formula method. The ratio method establishes a relationship between two quantities. It compares the drugs ordered to the amount on hand, where the formula method is a method used to simplify and determine the amount of drugs needed for the equation. It's the desired amount, or the ordered amount, divided by the dose on hand times the quantity of the supply on hand. So these are two very confusing and difficult equations to really kind of talk about on a video. But I know in your lab classes this week you will be spending a great deal of time on these. So please make sure questions that you do have, either bring them to myself or your lab instructor for the week. The last thing I want to talk about for Chapter 53 is the way to calculate dosages for pediatric patients. Pediatric medications and their dosages differ from those of adults, and there are several rules and laws that you need to use to calculate those dosages. First, we have Clark's rule. This is based on the weight of the child, and it's the most common calculation for drug dosaging for children. Freed's law is a law that applies to children under the age of 1. Young's rule applies to children who are over 1. And the West nomogram uses the child's body surface area to calculate the appropriate dosage of medication for children. And finally, we're going to wrap up this video with Chapter 55, which is talking about medication administration. So medications can be administered in several forms, such as orally, topically, rectally, by inhalation, or by injection, subcutaneous or intradermal. Orally is where the medication is swallowed and it enters the tissues of the GI tract, then is absorbed into the circulatory system. These can be pills, syrups, or other liquids. Also under the oral, we have sublingual or buccal medications. Topical medications are used for dermal application or mucosal application. Dermal applications are creams, ointments, lotions, or skin patches, where mucosals are eye drops, ear drops, nose drops, eye ointments, vaginal creams, vaginal or rectal suppositories, sterile douches, and all of these are very important that when you're using these medications, you want to make sure that you're wearing gloves so you don't yourself get the medication as it can be soaked in through the skin. Rectal and inhalation makes sense, and the other one is injection, which is a parenteral medication. And these can be things that are administered outside of the GI tract, such as your intramuscular, subcutaneous, or intradermal injections. When you are administering medications, it's always really important to follow the 3 befores, which state that medications need to be checked 3 times before administering. The first is before the medication is removed from the cabinet. Second is before it is poured, drawn up into a syringe, or placed into a medication cup. And lastly, before the medication is returned to the cabinet. Now, you also need to know the 7 rights of drug administration, which are right patient, right drug or right medication, right dosage, right route, right time, right documentation, and the patients, as always, have a right to refuse. Last thing I want to talk about is the medications that we can be responsible for as medical assistants, and knowing that they come in different forms. So medications can come in vials, ampules, prefilled syringes, or powders. Vials can either be glass or plastic. They can be single dose or multi-dose. Ampules are small sealed glass bottles containing a single dose of medication. Because they are sealed, what needs to happen is you'll need to break them open in order to draw up from them. Please make sure whenever you're using an ampule, you use a cotton pad or an alcohol prep pad when you're breaking them so you don't actually stab yourself with the glass. Pre-filled syringes are the easiest and most convenient for a medical assistant because the syringe already contains the medication. All you need to do is put a needle on it and you can then give it to the patient. And powder medications are the last ones. They actually need to be reconstituted. So this typically happens when we use sterile water or sterile diluent mixed with the powder to create a liquid that can then be drawn up and administered to your patients. Alright guys, so that is the quick overview for Chapter 8. This week you do have one discussion post, which is looking at medication errors, and you need to actually find an article or a case study that discusses an error within the healthcare facility and provide details about what happened, what was done to reduce the errors, the steps that were set up to improve this so it doesn't happen again, and if there were any obstacles in the way hindering the facility or the place of employment from doing so. Your initial discussion post will be due on Tuesday, May 23rd by midnight, and as always, you need to have one reply post to classmates no later than Saturday, May 27th by midnight. There are no written assignments this week, but you do have a weekly quiz. This quiz will be 20 questions with a 20-minute time limit. They are multiple choice or true-false, and that will be due no later than Sunday, May 28th by midnight. Alright guys, if you have any other questions, comments, or concerns, please make sure that you're reaching out to me via email, in course messaging, in Blackboard, or by phone at my direct line on campus, which you can find on our homepage. Have a great week, guys. Bye-bye.